Good afternoon. We're going to call this meeting the Health and Human Services Subcommittee to order. And at this time, we have two agencies that we'll be reporting out on. And at this moment, I'd like to bring up the Military Department, Ms. Fry, to read out for the Military Department. Thank you.
Thank you, Mr. Chair and the members of the committee. I am Yashoda Rai, and I'll be presenting the fiscal 26 budget analysis for the Military Department. The Military Department provides overall direction and maintenance of the Maryland National Guard, comprised of the Maryland Army National Guard and the Maryland Air National Guard. The department also includes the Maryland National Guard Joint Staff and the All-Volunteer Maryland Defense Force. The chart on page 1 shows that the fiscal 26 budget for the department increases by $1.8 million after accounting for the two proposed fiscal 25 deficiency appropriations totaling about $2.6 million, which are detailed in page 2. These proposed deficiency appropriations include $2.6 million in net total funds to support the Free State Challenge Academy, FCA's full cohort capacity of 300 cadets, and $70,000 in general funds for the National Guard members who were deployed to support Hurricane Helene recovery efforts in North Carolina. On page 3, Exhibit 1 shows a total of $45.5 million in the department's fiscal 26 allowance. Of this, about 54% is appropriated for the department's total personnel expenses. Exhibit 2 on pages 4 and 5 details the proposed fiscal 26 budget changes. Approximately $1.9 million of the change is attributable to salary increases and associated fringe benefits. This is partially offset by the Army National Guard facilities repair and maintenance and a one-time funding in fiscal 25 to replace 7 old vehicles. On page 6, personnel data shows that fiscal 26 allowance includes a net of 4 contractual conversions and a net increase of 7 new contractual full-time equivalent positions. As of December 31st, 2024, 49 vacancies were reported. Of these, 9 positions have been vacant for more than a year. DLS recommends deleting 5 of the long-term vacant positions. This reduces general funds by $86,000 and federal funds by approximately $196,000. On page 7, Exhibit 3 shows the vacancy trends as of December 31st for calendar years 2020 to 24. The red bars are December vacant positions, and the blue bars are vacancies necessary for the department. The vacant positions in calendar 24 more than doubles to 49 positions. The department notes that an internal hiring freeze due to operating budget shortfall resulted in higher vacancies. We request the department to comment on how the increased vacancies impact agency's operations and discuss its plan to improve staffing levels, including a status update on its internal hiring freeze. DLS also recommends adopting committee narrative for a report on the status of all vacant positions, planned or enacted changes to vacant positions, and active recruitment efforts to fill these vacancies. Moving to key observations, on page 8, Exhibit 4 shows that the Maryland Air National Guard has consistently maintained 100% functionality in their facilities. The Maryland Army National Guard facility functional status lowered by 9% in fiscal 24. This is below the National Guard's goal of 95%. On page 9, Exhibit 5 shows that the department has continued to attend the required 90% of the federally defined authorized troop strength, except in fiscal 21, primarily due to COVID-19. Page 10 discusses FCA operations. In 2023 session budget hearing testimony, the department noted that phase 2 of the FCA renovation project was in progress. We request the department to provide a status update on the renovation project. On page 11, Exhibit 6 presents FCA's performance measures. FCA aims to have at least 80% of its graduates continue their schooling, find employment, or enter the military. The yellow bars show that FCA has yet to meet the 80% goal. Green bars represent students with active mentor relationships, which has increased by 10%, and blue bars represent GED pass rates, which lowered to 34% in fiscal 24. This is the lowest GED pass rate between fiscal 2020 to 24, The dots show the number of enrolled students at 166 students in fiscal '24. The department notes that instructional staff were reduced due to funding shortfall in fiscal '24, which directly affected cadet enrollment. In fiscal '25 budget bill, a supplemental deficiency appropriation included $800,000 in general funds to provide additional funds for fiscal '24 FCA spring cohort. This increased the fiscal '24 general fund appropriation for the state operations program under which FCA is housed to a total of $4.3 million. Similarly, fiscal '25 working appropriation increases by $3.2 million in general funds over that funding level after accounting for the proposed deficiency appropriation included in the fiscal '26 allowance. The last paragraph on page 11 highlights the 2024 JCR requested report from the department on FCA's teaching staff and mentors and its long-term staffing plan. As of October 1st, 2024, the department noted that FCA's authorized teaching, mentor, and volunteer positions were filled. The department also noted that the turnover at FCA was relatively low and that 12 employees who were reallocated to support pandemic relief measures were still on board. Page 12 highlights the TRICARE Premium Reimbursement Program. In its December 4th report as required by the JCR Committee narrative of 2024, the department noted that about 950 service members of eligible National Guard members actively participated in the program. Of these, about 70% are Army National Guard members and 30% are Air National Guard members. Chapter 745 of 24 removed the prior reimbursement limit of up to $60 per month for this program, but the total amount of grants awarded in a fiscal year may not exceed the program's annual appropriation. After the enactment of this legislation, the monthly reimbursement cap increased to $150, which increased the average premium effective January 2025 to $83 per month for member-only plans and to $350 per month for members with family plans. DLS recommends adopting committee narrative requesting a report on the program's participation and rates, reimbursement claims, average premium amount for fiscal '26, and its plan to increase program enrollment. On page 13 is the last key observation that highlights a press release issued by the Governor's Office on December 23rd, announcing the transition of the 121st Fighter Squadron, previously part of the DC Air National Guard, to the Maryland Air National Guard. We request the department to comment on how this transition and the planned divestment of the 104th Fighter Squadron will impact the department's operations and budgetary requirements. Pages 14 and 15 are DLS's recommended actions. Pages 16 to 18 are appendices. This concludes my presentation, and I'm happy to answer any questions.
Thank you, Ms. Rye. Seeing no questions, if we could bring up the Chief of Staff, Ms. Weaver.
Good afternoon, Chair McCray and distinguished members of the subcommittee. I am Dave Palucci, and I serve as the Chief of Staff of the Maryland Military Department. I bring greetings from the Adjutant General, Major General Janine L. Burkhead. I'm joined by Dr. Linda Weaver, our CFO. Our department thanks Governor Moore, Lieutenant Governor Miller, the Department of Budget and Management, the Department of Legislative Services Analyst, Ms. Rye, and the Budget Committees for their support. It is an honor for the Maryland National Guard to serve the people of Maryland. From being called to duty, flying search and rescue missions at the Key Bridge, to domestic operation missions such as Hurricane Helene in North Carolina, to putting out wildfires in Baltimore and Harford counties. It is an honor for the Maryland Military Department to give back to our communities, while our citizen soldiers and citizen airmen remain ready to fight and win our nation's wars. With my remaining time, I want to focus on the most critical asset of our agency, our people. We aggressively search for people to join our MMD family. The department has filled 7 of the long-term vacancies, and 2 selections are pending. MMD does not concur with the recommendation of losing any of these pins. Under Governor Moore's leadership, Maryland launched Healthcare for Heroes last year. The program has exceeded our expectations and has enrolled 75% of all eligible service members. As our senior leaders state, Healthcare for Heroes helps us to make sure our soldiers and airmen are medically ready for the fight. Always ready to be, always ready, always there. The Maryland Military Department's Free State Challenge Academy is the only fully preventative program in the juvenile space managed by the state of Maryland. The 30-plus-year-old academy provides a tuition-free 22-week residential program that accepts 300 cadets, and through program attrition typically graduates 200 cadets per year. Together, the critical budgetary investment in public safety by the Moore-Miller administration's FY 2026 budget will ensure a more healthy military families, develop good habits in our young people, and contribute to a safer, more sustainable Maryland. Thank you.
Thank you, Mr. Chief of Staff and Dr. Weaver. I do have a couple questions. One of them being in reference to like the long-term vacancies. You speak to 6 of them that's being filled, 2 of them that's pending, but in the analyst, you'll see she references 9.
Yes, sir. There were 9 total. Of those 9, and there was a correction made. It was an internal fill to get from 6 we reported and submitted the other day in our testimony. It's 7 now that are onboarded, and 3 that are in process, or 2 that are in the process of staffing to be filled in the near term.
Okay. One of the things that's near and dear to my heart, and you guys are running a phenomenal program in reference to the Freedom Challenge Academy, but it speaks to like the educational outcomes and the decrease in lack thereof. So if you can like weigh in on that, that would be helpful.
Senator, the GED program is a challenging thing to get the kids through. It depends on how they come in, where they are. Everyone is assessed individually. Those that have the potential to sit for the GED are absolutely given that opportunity. Others we're on credit recovery, as they call it, picking up where they left off in their last course of academics, and then just get them as far as we can until they go back into the community and continue their education there.
Yep. I think you would agree that these young scholars are our responsibility. I think when I read the 16% decrease, as adults, we have to have some level of a plan, how we figure out how we're going to scale and get that to be able to sustain, but more importantly, to grow from that piece. So I'll weigh in offline about that piece. Just know that I'm sensitive to it, and I'm going to send it over to Senator Hettleman.
Thank you, Chair.
Thank you very much, Mr. Chair. I've had some conversations with my colleague to my left, who is not here at the moment, about the transfer of the planes from the DC squadron to Maryland, and I know that the DLS has highlighted that. Can you talk very specifically about what is happening with regard to that agreement?
Ma'am, specifically for the acquisition?
Yes.
We're not really in a position to speak on that. Unfortunately, there's so much still in the air. The announcement came from the governor's office, and sadly we have to defer to the governor's office for where that is in the process. I can speak to the divestment of the A-10s, the 104th, and the impacts possibly, but specifically us acquiring that infrastructure, the manning and equipment, we're not there yet, ma'am.
Okay, so you're telling me to go to the governor's office. You're not at liberty to discuss it.
I don't know that we have any more information, ma'am, that was presented, and we're not caught up on anything new other than that announcement being made.
Okay. All right, thank you.
Yes, Senator.
Thank you. I'm going to ask one more question, and it's probably appropriate at Capitol, so if you don't have the answer, I'll see you back at Capitol. But if you could speak to the renovations that's at the FCA from that standpoint.
Yes, Chair. I've got a few updates on that. They are continuing. I've got a list of things that have been accomplished. Pardon my...
If you could just email it to my office, and if you're
do
meeting your timeline too, it would be helpful.
Right, Chair. Can provide that update.
Yes, sir. Seeing no further questions, this ends the hearing for the military department. Just want to thank you, Mr. Chief of Staff. Send my regards. I always like seeing General Burkhead, so just tell her I said hello.
Michelle.
And
She's 2 floors down, Chair, at another testimony, so she's in the building.
Yeah.
Maybe she'll swing by.
yeah, that's my people. And Ms. Rod, just want to thank you for all the hard work that you're doing in reference to the state of Maryland. Colleagues, at this time, I would like to call up Ms. Camaro in reference to the Maryland Department of Health overview. You are.
All right. My name is Naomi Camaro. I'm a budget analyst with DLS. I will let my colleague Ann introduce herself.
I'm Ann Braun, also with DLS, here to help present the health overview.
We may be joined by a third person if she can get out of her other hearing in time. Okay, so for the Department of Health fiscal 2026 overview, the entire budget is decreasing by about 1.3% to $21.5 billion. On page 4 begins discussion of some of the activities, some of the actions affecting the fiscal 25 budget that are included in the fiscal 26 budget bill. At the top of the page, we've listed out 3 planned reversions for fiscal 25. One is nearly $2 million for oversight of the Board of Nursing Operations in the Office of the Secretary. That role is sunsetting. There's also $26.5 million in planned reversions under the Behavioral Health Administration due to unspent grant funding for fiscal 24 and a surplus for fiscal 24 behavioral health Medicaid services. The bottom of page 4 through page 5 lists out some proposed deficiencies that total a net increase of $2.25 billion to the fiscal 25 appropriation for the Department of Health. There's a comprehensive list of deficiencies included in Appendix 1. I'll just point out a couple large ones at the top of page 5. There's $740 million in deficiency in DDA to support community services, which are slightly offset by other cost containment actions. And then there's $650 million in planned reversions in deficiencies related to shortfalls in traditional Medicaid and behavioral health Medicaid services. On page 6, there are a list of cost containment measures that were authorized by the Board of Public Works in July of 2024, the largest of which is a $12 million reduction in core public health services funding for local health departments. On page 7, this pie chart breaks out the spending across the entire department for fiscal 26. A majority of the budget, about 86%, is going to provider reimbursements for Medicaid, behavioral health, and DDA. Pages 8 through 10 summarize the changes between the fiscal 25 and the fiscal 26 budgets. The entire budget is decreasing by about $290 million, and that decrease is really driven by some items in Medicaid. On page 9, you can see negative change related to reduced enrollment and utilization in Medicaid and a fiscal 2025 deficiency to cover 24 shortfalls. There is, however, some more modest increases due to provider rate increases under Medicaid. Pages 11 and 12 list out the contingent reductions totaling $240.6 million of general funds that would be reduced contingent on the passing of the BRFA. Some of the larger ones I'll note at the top of page 11 are $92 million in general fund savings under Medicaid, contingent on the hospital deficit assessment increasing. There's $90 million in special funds that would be reduced from the Consortium on Coordinated Community Supports. And then there's $29 million in DDA contingent on the provision of the Self-Directed Services Program being modified. There's also additional cost containment measures for DDA that are not contingent on the BRFA that equal about $418 million. On page 13 begins discussion of personnel across the department. The fiscal 26 allowance includes 7,391 regular positions and nearly 350 contractual FTEs. Exhibit 1 shows the change in the number of positions between fiscal 25 and fiscal 26, and you can see that there isn't actually much change. This is partially because MDH added about 700 new positions in fiscal 25, 236 of which were contractual conversions. Exhibit 2 on page 14 shows the growth in the number of positions between fiscal 24 and 25, but you can also notice that the vacancy rate is increasing. And as of December 31st, 2024, the department-wide vacancy rate was 15%. DLS has asked MDH to comment on the status of filling these new positions, given that increase in vacancy. Pages 15 through 17 summarize some of the efforts that the department has taken to improve or increase recruitment and improve retention, including annual salary reviews. So Exhibit 3 lists out the classification series that received ASRs in fiscal 23 and fiscal 24. And the department noted that in general, these adjustments were effective in improving recruitment and retention compared to fiscal 2022. I'm now going to turn it over to Anne to lead our discussion of issues.
All right, so the first issue has to do with home and community-based waiver or services waiver programs under Medicaid. I'm going to highlight the ones that have registries or wait lists. So that includes community options and the model waiver under Medicaid, the 3 DDA waivers, which are all handled in one wait list, and then the autism waiver, which is administered by the Maryland State Department of Education. On page 19, Exhibit 4 shows the recent statuses of all these registries and wait lists. You can see that they vary greatly in size, with the Community Options Registry having more than 20,000 individuals in each of the years, and then they range to a much smaller number, like the DDA Community Services waiting list being less than 4,000 individuals. From fiscal 23 to the end of fiscal 24, there was some decrease in some of these registries. In the Community Options Registry, it decreased by 13% as about 3,214 individuals were removed. And then in the Autism Waiver Registry and Wait List, there was a 15% decrease with a little over 1,000 individuals removed. And although both those waivers show decreases in their registries, they show different trends, as enrollment in the autism waiver increased, but enrollment in community options decreased. In fiscal 24, MDH didn't use all of its budgeted slots for community options, and so the reduction in the registry is more a sign of higher rates of individuals not returning applications and then being removed from the registry, rather than being enrolled in the waiver and then receiving the services. MDH has described multiple reasons for not filling all of its community option slots, including a few items listed on page 20, such as the limited capacity of the provider network, ineffective methods for pulling people off the waiver registry, delays in application processing, and low return rates for applications. Exhibit 5 shows MDH's outreach efforts and results for community options application processing. So the bar on the left shows that in fiscal 24, MDH sent out an average of just under 600 applications each month. There was 2022 legislation that requires 600 applications be sent out each month. And as of December 2024, MDH has actually surpassed this requirement and is now sending out 700 applications each month. Despite this expanded outreach, the second bar on the left shows that less than 1/3 of these applications end up being returned to the department. Despite the low return rate, MDH is still not able to process all of these applications each month, as at the end of each month, about 84% remain pending. MDH has indicated persistent staffing shortages as the main factor for application processing delays. For example, MDH reported a vacancy rate of 37% in fiscal 24 across the positions that would handle application processing and eligibility determination for community options. In June 2024, MDH began using its contract for a utilization control agent to assist with some of the backlog in reviewing plans of service. And so that's one of the places where there can be delays. And then, so moving on to page 22, this begins a discussion on registry reduction plans that were required in the End the Wait Act. In February 2023, MDH submitted 5-year plans to reduce the HCBS waiver registries by 50% and estimated a wide range of potential state costs depending on the waiver. The Community Options Waiver Plan has overestimated new fiscal 24 enrollment, but has still seen decreases in its registry due to the expanded outreach efforts and other efforts to improve data sharing to remove deceased individuals and individuals who have moved out of state from the registry. MDH is asked to discuss an updated timeframe for reducing the Community Options Registry by 50%, including the feasibility of transitioning from a registry to more of a wait list that would allow for some eligibility screening or determination to be done before people are added to the list. And then any other proposals to more efficiently enroll individuals in Community Options waiver. One of the ongoing issues that MDH has described for reducing the registries has been limited provider capacity and a shortage of direct support professionals. And so MDH described efforts to build capacity among the providers, such as rate increases, surveys on workforce challenges, and technical assistance. MDH also described an effort to expand capacity specifically for individuals waiting for model waiver services. And so that waiver has a registry of about 180 individuals, but that program is capped at 200 slots, which are currently filled. And so by applying for a new waiver, that would allow for additional capacity to serve those on the registry. And so MDH is asked to provide a status update on applying for that new waiver and whether the fiscal 26 allowance includes any funding for that type of program. To support End the Wait activities, $30 million was added to the dedicated purpose account in fiscal 23, initially to support autism waiver expansion, but then the uses were expanded for any other Medicaid HCBS waiver expansion. Of this funding, $22.7 million has been spent or is appropriated, and so that leaves approximately $7.3 million in the dedicated purpose account. Across fiscal 24 and 25, a total of $16 million was budgeted for End the Wait initiatives. Cost containment actions approved by BPW in July reduced $10 million of this funding, and then the fiscal 26 budget plan proposes to transfer the remaining $6 million from the dedicated purpose account to the general fund as part of further cost containment. So that concludes the first issue. I'm going to pass it back to Naomi for the second issue.
The second issue in this analysis has to do with the overdose crisis in Maryland. According to the CDC, between fiscal 2015 and 2024, more than 22,000 individuals died from an overdose in Maryland, and nearly 90% of those deaths involved opioids. As you can see from Exhibit 6, the fatality trends during this period in Maryland are very similar to those experienced nationwide. And while there were decreases between fiscal 23 and 24 in the number of overdose fatalities, the total still remains quite high compared to the 2015 amount. On page 25, there's a discussion in an exhibit related to some of the disparities that exist between overdose fatality rates by gender, race, age. As you can see, the largest rate of fatality increase between calendar 2022 and 2023 was experienced by non-Hispanic Black males age 55 and above. When aggregating for all ages, Hispanic males saw the greatest increase during this period. There's also disparities between different geographies. So on page 26, Exhibit 8 shows the 24 jurisdictions in Maryland overdose fatalities and the fatality rate between December 2023 and November 2024. Baltimore City makes up about 44% of the total overdose fatalities in the state. And there are 6 other jurisdictions whose fatality rates exceeded Maryland's average. On page 27 begins a discussion of some of the funding that the Department of Health uses to address this crisis. Exhibit 9 on page 28 summarizes the federal funding that the state has received between fiscal 2018 and the fiscal 26 allowance. Most of this funding is from the State Opioid Response Grant, which is issued through SAMHSA, the Substance Abuse Mental Health Services Administration. This is for targeted opioid abatement grants to local jurisdictions and community organizations. The state also receives substance abuse block grants from SAMHSA, and starting in fiscal 2022, also received COVID stimulus enhancements for the substance abuse block grant. The Behavioral Health Administration also has various programs dedicated to addressing this issue, and in recent years, BHA has invested millions of general fund dollars into various initiatives, some of which can address substance use dependency. So the fiscal 25 legislative appropriation included $89.2 million for various behavioral health investments. But the fiscal 26 allowance includes a proposed deficiency of $30 million due to implementation delays of some of these initiatives. DLS is asking MDH to comment on which programs and efforts were delayed, resulting in the withdrawal of fiscal 25 funds. Maryland also receives opioid settlement revenue from litigation between opioid manufacturers and distributors and the state. The Opioid Restitution Fund houses that funding. Per the settlement agreement, some of this award also goes directly to the local jurisdictions. At the close of fiscal 2024, the ORF had received $158.4 million in fiscal 23 and 24, and local jurisdictions had received $42.8 million directly from the settlement awards. The Opioid Restitution Fund Advisory Council meets regularly and provides recommendations on how to spend the opioid restitution funds. Some of these dollars are restricted per the settlement agreements, but majority of the discretionary funding has been distributed as grants. Exhibit 10 on page 30 shows the funding that's been received since fiscal 2022 and is projected to be received through fiscal 2028. This includes the funding that's going to the ORF, as well as the funding that's going directly to subdivisions. As I said, a majority of the funding is distributed as block grants or through competitive grant programs to local governments and community-based organizations. But some of the funding has also been used on data projects as well. I'm now going to turn it back to Anne for our final issue.
So the third issue has to do with the Cigarette Restitution Fund, and that's the special fund for payments from tobacco manufacturers each year through the Master Settlement Agreement. Exhibit 11 on page 32 shows that CRF revenues across the 3 years show a gradual decline of more than 8%. Revenues are expected to continue declining in the long run due to the consistent reduction in tobacco use in Maryland. If you turn to Exhibit 12 on page 33, you'll see that fiscal 24 CRF revenues were about $25 million less than expected. And in fiscal 25, the projected revenues were also expected to come in about $26 million less than is currently budgeted. Was budgeted at the legislative appropriation. The biggest changes were lower inflation than expected and then a larger negative adjustment for tobacco volume. Moving to a discussion on CRF spending, Exhibit 13 on page 34 outlines CRF uses from fiscal 24 to the allowance. To account for the shortfall in CRF revenues in fiscal 24, you can see that the amount for Medicaid was reduced by $25 million and backfilled with general funds, and there was also a small amount of underspending in other areas. To cover the shortfall in fiscal 25, the budget plan proposes negative deficiencies that would withdraw a total of $27 million in CRF for substance abuse services. In addition to breast and cervical cancer diagnosis and treatment services, and then Medicaid. All of that amount of CRF support is backfilled with general funds. In fiscal 26, you can see that some of the CRF support for those programs is restored after the deficiency withdrawing those funds in fiscal 25. The fiscal 26 allowance also includes 2 cost containment measures that are contingent on actions in the BRFA. The first is a $13 million reduction from the statewide academic health centers for UMS and Johns Hopkins. And in the BRFA, there's a provision that eliminates the mandate for those grants. In fiscal 25, they were provided slightly more than the mandated funding level, and so that's why the decrease from fiscal 25 is appearing as $15 million. There's also a $250,000 reduction in fiscal 26 for the Tri-County Council for Southern Maryland, and that's for the Southern Maryland Agricultural Development Commission. The BRFA includes a provision that reduces the fiscal 26 mandate from $1 million to $750,000, and then the provision also phases out that mandate entirely through fiscal 28. CRF uses are restricted in statute. One of the requirements is that 50% of budgeted spending supports certain programs and uses. Those are listed on page 33. But considering these contingent reductions, the fiscal 26 allowance funds these uses at only about 43%. And so DLS is suggesting that MDH and the Department of Budget and Management propose a BRFA amendment to waive this requirement in fiscal 26 only so that it aligns with the budget. The next section discusses ongoing litigation between the state and participating tobacco manufacturers regarding the non-participating manufacturers adjustment. If participating manufacturers can prove that certain conditions were met, like showing a market share loss due to the master settlement agreement, or that states were not diligently enforcing its statute, then their annual payment may be reduced. And so each year an adjustment is made to put some of the master settlement agreement payment into escrow pending the results of the arbitration. 2021 legislation requires that payments received as a result of this litigation be placed in a separate CRF account and that the funds replace general fund support for the HBCU settlement payments. And for sales year 2005 through 2007, an arbitration panel decided in Maryland's favor that it did diligently enforce its statute, and so approximately $25 million is expected to be recovered. The budget plan doesn't currently account for this funding, and so DLS recommends first adding a BRFA provision that would allow the separate CRF account to support Medicaid expenses in fiscal 26 only, and then reducing $25 million in general funds for Medicaid in fiscal 26 in anticipation of these funds. These recommendations will appear in the Medicaid analysis that'll be presented later in session. Starting on page 38, there are appendices that provide additional budget and personnel data, but otherwise that will conclude our presentation and we're happy to answer any questions.
Senator Hadelman.
Thank you, Mr. Chairman. I have a question with regard to IT and a recent Do-It audit report that discusses the progress and the cost of the Medicaid Enterprise Systems program, and that has provided, I guess, about $200 million in federal money to kind of rebuild post-cyber attack a couple of years ago. Can you tell us what the investment is this year, what the status is of that? I didn't see that in the report. So, I mean, I know that there were a few lines having to do with IT investment, but if you could comment on that.
Yes, I apologize. I don't have the Medicaid major IT budget with me today. That will definitely be covered as part of the Medicaid analysis. So I will be happy to follow up then. But I apologize, I don't have it.
No. And it's hard to know what's appropriate to do here and what's appropriate to do there. So totally understand. Thank you.
Senator Zucker.
Thank you very much. Thank you for that analysis. I know you mentioned end the wait. Can you just explain again to me what the purpose of end the wait was?
The legislation required the department to come up with plans to reduce the waiting list by 50%, I think within 5 years. And there was also a piece on the autism waiver to make that more of a wait list and to get more people off that wait list onto services. But for the other HCBS waivers, it was to come up with a plan to reduce the registries by 50%.
Right. And my understanding is that there was a backlog of people that were waiting for services that were waiting sometimes 5, 6, 7, 8, 9 years for these services. So the whole purpose behind, I think, end the wait was to get them from waiting into service. And how much money was already spent on End the Wait?
In terms of the funding that was like set aside in the dedicated purpose account, it was that 16 million, and both 10 million put in last year and then 6 million put in the year before, both would be transferred to the general fund. And so none of that funding had been spent and is now proposed to be reduced for cost containment.
So, so how much money is left in the Wait Fund? Zero?
Zero of those 16 million, there were, I believe it was 7 million remaining from the 30 million put in for autism waiver expansion. So there is still the autism waiver expansion funding what has been spent or appropriated, and then 7 million is remaining of that. But the 16 million, I don't believe any of it was spent, and it's being transferred out.
Okay, thank you.
Second bite of the apple. Senator Hedelman.
I have a question. On page 8, there's a line, expiration of federal stimulus funds for COVID-19 vaccine and surveillance and behavioral health activities. Could you explain that? Is that money that went back to the federal government because it wasn't used?
No, it's just this is showing the change between the 25 budget and the 26 budget. So it just means compared to 25, there's that much less in the 26 budget.
Okay. Because we don't have federal money coming in.
Right, because some of these awards are expiring.
Okay, but does it mean that we use them?
I would have to check on like every specific grant, but thus far MDH indicates that it's used nearly all of its funding. That would be a good question for the department to double check.
Thank you.
Thank you. Seeing no further questions, at this time, let's bring up the Department of Health. Madam Secretary.
Good afternoon. Good afternoon, Chair McCray, members of the committee, Laura Herrera-Scott, Secretary of Health for the record, and with me today at the table is Emily Brandenburg, our Chief Financial Officer. In the audience is also Dr. Ryan Moran, Deputy Secretary of Healthcare Financing and Medicaid Director, and Alyssa Lord, Deputy Secretary of the Behavioral Health Administrations, depending on what questions you ask. I'd like to thank our DLS analyst, Naomi Kimura, for her thoughtful analysis. Today is an overview of the agency, and clearly there will be subsequent budget hearings that will have a more in-depth review for our different administrations. But before I jump into the question, I really want to speak to the governor's allowance and how the fiscal year 2026 allowance represents substantial progress on critical healthcare services in light of tough fiscal constraints and federal uncertainty. The budget includes record state funding for Medicaid in FY25 and 26, assuming more than 1.5 million Marylanders will have access to care through Medicaid, including 700,000 children. With that, I'll jump into our responses. The first question was around commenting around filling the new positions. And I just want to say prior to the new positions, our vacancy factor was right around 10%, a little bit less if you excluded the positions from the Office of the Attorney General, which don't report to us. But those new 700 positions included in this year's budget, 116 of them have been filled. 391 positions have been created but not yet filled, and 193 positions are in the process of being created. Creating and filling this many positions has been a big lift, and it involves coordination among multiple offices at MDH and DBM. And we note that 1/4 of the 391 positions that were created but not yet filled are tied to staffing at JLG RICA that recently opened new units, and Finan, which won't come online until next year. In other cases, we are holding new positions vacant in order to operate within budgeted turnover levels. We were asked to provide an update on our projected timeframe for reducing the community options waiver by 50% and estimated enrollment in slot expansions through fiscal 2028. The department has been working and is working with Hilltop Institute to provide a more comprehensive answer concerning the projected timeframe for reducing the registry by 50%, and we will share the information with the committee once it's complete. We've implemented several strategies in the interim to more effectively enroll individuals in the waiver and reduce the registry. A few of them include, we increased the number of community option waiver program invitations, inviting registrants to apply from 300 to 700, which is mailed each month, and you heard that stated earlier. We have partnered with Vital Statistics Administration and the Hilltop Institute to remove deceased individuals from the registry, and we anticipate this process to be completed by March 31st of this year. We have also partnered with the Department of Aging on screening processes to more accurately ensure those potentially eligible for the waiver are added to the registry. So these actions, as well as others listed in our response, have decreased the registry by around 1,500 registrants. And we want to note that additional staffing resources would be needed in both eligibility services and long-term services and support within Medicaid to support the transition of the registry to a wait list. Responding to the second prompt around the FY26 allowance does not include a budget for the technology waiver. That is due to the limitations of the budget. The department did not apply for the waiver. In response to the question concerning the behavioral health enhancements budget, 30 million negative deficiency accounts for cancellation, delayed implementation, and rebudgeting decisions involving several initiatives. Those initiatives included funding the Behavioral Health Services Administration, the BASO contract, so that's the Optum contract that we just moved to Carillon, the scaling of 1915I services in future years, and those are some of the intensive case management for children with severe emotional disturbance that will help address some of the kids stuck in the emergency room department. Early and periodic screening, diagnosis, and treatment rate increases for behavioral health, and implementation of mental health peer services in federally qualified health centers. Lastly, concerning the cigarette restitution fund questions, MDH concurs with the amended BRFA language recommended by DLS. DBM will propose the requested amendment to the BRFA. In consultation with DBM, the department respectfully disagrees with DLS to add a provision that expands allowable use of CRF. While the arbitration panel estimates Maryland awarded approximately $25 million, the final amount and timeline for the receipt is uncertain until all participating states resolve their cases. Some states have yet to have a trial date set. The Office of the Attorney General's office shared a definitive timeline that could not be provided, but anticipated all states would likely be settled by 2027, at which point Maryland would receive those funds. Thank you again for your time, and I'm happy to answer any questions you have.
Well, Madam Secretary, just thank you as always. I did have a question in reference to Medicare Advantage. It's probably appropriate, like HSCRC, but I wanted to lean in here from that standpoint. Knowing that we just got finished with the HID model in reference to the agreement, knowing some of the challenges, and this precedes you in reference to issues that I've had with Medicare Advantage and the level of service that we give to some jurisdictions versus to others. If you could speak to the last 2 years you've been Secretary, correct? Some of the work that you've been doing around Medicare Advantage.
So as part of the negotiations on the AHEAD agreement, which actually goes into effect next year, we're still operating under the old agreement that was previously determined. We had multiple conversations with CMMI and the leaders at CMS around Medicare Advantage and some of the concerns around the rates in the state of Maryland because of the global budgets. At the time, we're negotiating a pathway through AHEAD around value-based payment arrangements for Medicare Advantage plans. I will say with the change in the administration, we're not sure at this point what the path is forward for MA.
So I heard you loud and clear when you said the program, the HID model will be implemented in 2026. I was under the perception that it was already negotiated, or no?
It is negotiated, and that deal was signed in November officially after a year plus of negotiation, but the start date is not till calendar year 26. Okay. So we are still operating on the last year of the prior 5-year negotiation, 2019 to 2025. So we're ending on the negotiation that was the model that was negotiated under the prior administration.
Okay.
This is the last year. 2026 is when AHEAD goes live.
Okay, I'll take my questions offline, but I want to give you my thought process. I was super frustrated in reference to when one of the Cadillac plans had left the city of Baltimore, and they still were servicing other jurisdictions in the state. But one of the things that they stated was, obviously, from a cost standpoint, that it wasn't conducive to be operating in Baltimore City, and they consistently spoke to the agreement that we're currently under, which was, I guess, prohibiting them or giving them factors that removed them from Baltimore City, and stated that this ahead model or any type of the next agreement would be how we either got back to where we were or like the impacts of Medicare Advantage. So I'll talk to you offline about it, just better understanding how the ahead model impacts Medicare Advantage.
So if I can just take a minute. So the issue is the way that CMS has set rates for Medicare Advantage in the state of Maryland because of the enhanced payments that go through hospital rate setting process by the Health Services Cost Review Commission. So there is a lot of money coming through the rate setting process under the total cost of care model. And again, under the prior leadership, the idea was the resources are there, we need to come together and solve the issue. So we were working on a path forward, but now we have a change in leadership, so the conversations have kind of stalled. But happy to meet and go into greater detail, or as much detail as you want, about Medicare Advantage and how reimbursement works. But reimbursement is set by CMS, not by the state for MA.
I got it. And I just wanted to be clear for my colleagues that the actions that I'm talking about did precede your tenure in that space, but obviously you're the leader at this moment, so when we talk about course correction, I have to have that conversation with you. Senator Hedelman.
Chairman, I have a couple that I'll put all in at one time, if I could. I just see that there's a $9.8 million emergency contract for
What
HVAC.
page? What page?
Sorry, page 5. The second to last bullet, this HVAC system at Perkins. So $9.8 million is an emergency contract to temporarily replace. Could you expand on that a little bit, please?
Sure. So the boiler stopped working, and we weren't able to provide heat to the participants at Perkins. And so through an emergency contract, the company that we worked with actually installed a boiler almost outside the building that's connected into the building. And we are in the process of working on the entire HVAC system, but that was because the boilers, if you were to see them, look like they're from the 30s or 40s or whenever that building was built, but they're very, very old and really hard to fix and or find parts for, finally was giving out. So that's what the emergency contract is for.
So is that, it says temporarily replaced, so is there money in the budget for a new system, or this is what we're going to use to nurse things along until something else happens?
Sure, it's a temporary HVAC, temporary boiler system as we work to replace the boilers over at Perkins. And so you'll see that in the capital budget when we get to that piece of it.
Okay, thank you. In your comments, you talk about how difficult it is to hire people and the process. Can you tell me how long it takes?
So it depends on the role. So for certain positions, we pay very well, and for other positions, we don't pay as well. And so it really depends on the role.
I actually mean the actual process of once you have found someone, how long a delay it is before you can actually have them working. You extend an offer and then how long?
It can be, once the offers are extended, it's dependent on the notice that the person has to give before they can start the job. So it could be 2 weeks. If they're unemployed, it could be immediately, or in some cases, I have to give 2 months leave and I can't start for 2 months.
Okay, but in terms of our internal bureaucracy, that maybe I'm missing something. I have a sense from your written comments that the internal machinations that you have to go through are lengthy and cumbersome, and I just wanted to give you an opportunity to shed a little light on that.
For new positions, we have to create those positions within the framework of position types that we have in the system. And so it's not always a clean fit depending on the roles that you want to fill. Although for the facilities, those are pretty clear. The facilities are pretty prescribed. But you still have to create the what's called the MS-22, which is like the job description and the responsibilities. All those things need to be created to be uploaded in the system. So oftentimes, quite frankly, it's on us and the people that need the positions filled, but you don't have a lot of people, and it's fine to do it for 1 or 2 or 3 positions, but when you get hundreds of positions, it's just a lot of work, and we don't have people whose only job is to do that. Usually it's the manager or the leader that's hiring in that area that does the updates on the job descriptions and the other information that's needed to get the job posted. So also having been in corporate America, I will say 700 positions is a lot for any entity to fill in a short period of time.
Okay. And one final question, I'll leave the IT question for later. But can you tell me the question about whether you had to return any money to the federal government as a result of COVID funds?
So I think if you do have this, it's grant dependent, right? So we have public health coming up shortly, or rather FIPA, that's our next round, and there's COVID grants that we have explicitly laid out during that analysis. That might be helpful, or maybe we can come back to you with a list of our different grants and let you know that were related to COVID, and let you know how much of it was obligated, how much of it was spent.
Okay. Are we past the point of having to have spent it?
It's really grant dependent.
You
Right.
still have some that are still live?
Absolutely.
Yep.
Yep.
Okay, thank you. Thank you, Mr. Chair.
Senator Zucker.
Thank you very much, Mr. Chair and Madam Secretary. Appreciate you being here. And the wait, obviously, is something that we've spent a lot of time on. Board of Public Works, I guess, made an adjustment, made a cut over the summer, 10 million, and then in this Budget Reconciliation Financing Act, it looks like there's an additional 6 million. Have deepest respect for the governor, so I'll take a lot of this offline. I guess the bigger question I have is, there's so many children and vulnerable people in our community who need these services. So why weren't we able to get the money out the door? Why was it still in the dedicated purpose account?
I will tell you on the $10 million, we were working with the DD Council and DD community to figure out, well, what does that plan look like? So that was in partnership, and we just didn't come up with the plan soon enough to then execute on the plan. We had to get an RFP to get a consultant to sit with us. We wanted to include stakeholders in that process, and by the time we got the plan, it was near the end of the year. So that is the only reason. I will say that some of the work that the department has been trying to do about right-sizing DDA was to be able to move the wait list in a cost-neutral way.
Yeah, colleagues, it's interesting is with the realization of, it was coming up to a year, the dedicated purpose account isn't based on, it doesn't matter about a fiscal year, it's a dedicated account. So that money would stay until that purpose is met. The only way dedicated purpose account money can be moved is by a budget action. So, all right, well, thank you. I'll follow up with the governor's office. Thank you.
Seeing no further questions, Madam Secretary, look forward to our continuous dialogue that we'll be having throughout the session with the rest of the budget hearings. And Ms. Camaro and Ms. Braun, didn't expect you, but it's always good, and thank you for your leadership and what you do for the state of Maryland. Colleagues, seeing that this is our last agency hearing, this ends hearings for today. Thank you.
Thank you.